lawyers, they're trained by public funding.
They don't pay for your education. We pay for the doctor.
We pay for lawyers as well. Well, not in Ontario because you've been hiking up tuition fees, but it was not always like that. See, well, we have to come back when it comes to public health care. We have to come back to the main lessons that we heard when we enacted public health care, which was supported by Nobel Prizes in economy, saying that there is no way that the private market can look after a whole population under its rule of profit. It just doesn't work because as a private enterprise, you do only, you go for markets that bring money. You cannot make money out of the majority of the people because they're too sick and they don't have the money to pay. And therefore, we have to design another type of system. And that's the whole idea of public service. The whole idea of public service, and that goes for roads and also for hospitals, is that we need to bring together the funding from all over the population in order to provide this service that anybody can have access to, regardless of their needs. But we push that idea to the furthest with the medical care because, we're talking about life-threatening injuries and sickness. We're talking about things that come to the core of what we need as a human being, who we are as human beings, and therefore we decided as a society, if we want everybody to have access, we've got to design a different way of funding than what the private enterprise will go for.
So basically our values are misplaced.
Our values
Something that's a lot of people around here.
yes, but it's the same as we said, democracy is the best system, that's the best one we've found so far. But we've got to make sure to be after our permissions and make sure that we do decide for what we want. Sure. Can't let them do what they want because, the heavy lobby is having it right here. We don't always do that.
I'm going to go to the next question. There's two very similarly. Has asked what we can learn from the British Isles, and the other says, can you please give more information as to the UK and privatization? Can you speak to that?
Well, yeah, I did mention that the British system was something that we should look at in order to learn some lessons. Well, first of all, it's interesting to notice that our Medicare system in Canada is modeled after the British system. You know that. Two different models. There was the German one, the Bismarckian system, where funding for healthcare is paid for through workforce, as part of your salary payment would go and you would insure. That's the German model that was enacted in 1883-85. It's the oldest one, and that's the one that applies through most continental Europe. But in England, they designed a different system where the system was financed through general taxation. That's what we have in all provinces and in Canada. So our main structural model is British, but we have major differences with the British system, and that is the Saskatoon agreement, where physicians are not employees of the state, which was not the case in England. Physicians became salaried by the NHS. So what happens through NHS is meaningful to us because, and our politicians very often look at England, and they tell us if it's done in England, it's got to be good for us, right? After all, we're a colony. This sort of colonial thinking too often goes on. But you know that there's been a lot of reshuffling in the NHS when the Conservative came in, mainly after Margaret Thatcher, actually. She looked after other things like trains and all that, but major Prime Minister was the main one to do major things through the NHS. And one of the things he's done is to include so-called competition internal markets within the NHS. And that's when they started to subcontract some surgeries outside of the hospital, outside of the NHS. So this has been done, and we have data on that, and we know what it does. We know that, for instance, it costs more. So all the talk saying that we're going to save money if we let the private enterprise take over some of the high-volume surgeries, well, Britain being the main place where this has been done proves to the contrary. And you can Google and see reports that have been presented at the House of Commons that just, document that. The second thing, there was a waiting list, wait time problem in England as well. So they tried to tackle that, first of all, through this, and we're going to subcontract it, that's going to relieve the public system. There are all kinds of things one could say about the wait list, but to say it in a nutshell, most literature will agree that what really did help was when the labor came in and they pulled in a lot of money into the system. It's not the fact that the private insurance is allowed in Britain and the subcontract. It's because a lot of money was poured into NHS to try and tackle the problem of waiting lists. So the privatization, internal market, and so on in England does not demonstrate that it will solve the problem that we have to tackle in Canada.
I just want to add to that. I think this is
Australia also experienced a similar model, and there is a paper from Australia that basically says lessons for Canada from Australia, because they did start putting money back into their public hospitals again. You have a question?
Yeah, I just wanted to offer a supplement, having lived with the NHS for 12 years in London, that the increase they started moving around the NHS trust, so you might live in the heart of North London, but certain things weren't being done in your NH trust area within North London. But I could go 2 kilometers east into the city of East London NH trust, and let's say I needed to get a hip replacement. That one might be on the list that's going to be covered, but the one in my area isn't on the list. And after Blair got it in 97, they put in a lot more money, but one of the big increases in this, and this is what privatization does, was a 25% increase in the amount of managers that were required by paper pushers to administer all this sort of thing. So when you do one size fits all, is far better than, like the American system, the biggest cost is all the administrators and following up on insurance and who's got this and who's got that. Is that not?
Absolutely, you're absolutely right. Good point. Thank you.
Sorry.
I'm getting a low battery signal here, so I better say this fast. What problems might members of disabled groups experience as privatization continues and advances?
That's a very important question as well. Which group of people will be most affected? Of course, most vulnerable people are to be affected. Why? Because the private lucrative market don't want to care about people who are sick or who need services. I mean, it's a bit of an exaggeration, but not too far. That's the first thing. The second thing is, we haven't talked about that, but I think it's important to remind that as well. You know that the Canada Health Act, when we talk about universals, healthcare system, it's very limited, as you know, right? It's hospital services and physician fees, period. That's it. The rest, which we may call social services, they're important in the way of health, when we talk about rehabilitation, when we talk about support, when we talk about all those other services that handicapped people may have, they're not protected through a universal principles, the way hospital and physician fees are. And therefore,